Go ahead, Mom. Tell us about what she was up to back then.
She was an amazing dancer.
Okay.
She also took third place at her regional science fair.
Great.
An amazing student.
Great.
Very active.
Very active.
Very
so this
active.
has put quite a big dent in her career and her life, right?
Yes.
Yeah.
You know, in fact, she had injuries from dance before, but nothing has ever stopped this kid.
Right.
Until October 1st, when she had the tetanus booster shot, and life dramatically started to change and turn, and she stopped.
Right.
Life stopped for her.
Right. So today is April 8th, 2014, and it's now approximately 2 months since your ketamine infusion, your 4-day ketamine infusion, okay? And before we go any further, we got to make sure we know where everybody that's here. Okay, here's Mom, and here's you, the patient. And here we have, what is your name now?
Bella.
Ella?
Bella.
Oh, Bella. I'm sorry, Bella. And how old are you?
9.
And you're the sister, right? And here's another one down here. What's your name?
Alea.
Elena? Okay, and how old are you?
Alea.
What?
Alea.
Alea. All right, Alea. So how old are you?
4.
4 years old? All right, very good. So we got everybody introduced here. All right, let's go over your history just a little bit, Elizabeth. All right, so back in October of 2013, you had a flu shot into that left shoulder area, right? It was a tetanus booster, right?
Yeah.
And you ended up getting real sensitive skin there. As a matter of fact, your whole body became sensitive to light touch, right?
Yeah.
And then it seemed to settle down into your legs, right? Down into your feet. And in fact, you couldn't even walk, okay? You were unable to walk, which is terrible to be 11 years old and can't walk. And so, so you came here, we made the diagnosis of you have this complex regional pain syndrome. And so we decided to go ahead with this 4-hour a day for 4 consecutive days of the ketamine. And we're talking now about the ketamine being given as conscious sedation. In other words, not to put her in a coma, but it's what we call sub-anesthetic ketamine, okay, 4 days. Okay, we did your pain thresholds, and your pain thresholds demonstrated a profound improvement in your pain. Okay, that was an objective measurement. And also at that time, you could walk for the first time where you couldn't walk before. And we're going to show a little video clip here where in fact, the only way you could transfer yourself from that chair to that chair is to crawl from one to the other. Am I correct on that?
Yeah.
All right. Okay, very good. Now, so let's go ahead and run you through the usual exercise program here. So go ahead and put 2 vertical fingers in your mouth, see if you have any pain. Any pain when you do that? Okay, no pain when you started either. Okay, go ahead and put that right hand behind your head. Any pain when you do that? No. Now do the left side. No pain when you do that, right? Okay, you didn't have any when you started. Now, you did have some issues here with regards to the sensitivity just above your ankles on both sides, right? So what I want you to do is take off those sandals now and close your eyes so you don't cheat, and go ahead and rub your hands down there and see if you have any more of that sensitivity down there. There's a black line down there where you had it before, where it felt like road burn, right? You don't feel that anymore, right? Now do it on the other side. Do the same thing. Okay, there you go. No sensitivity? All right, now go ahead and rotate your ankle on the right side, please. You had a lot of pain when you did that last time. What's the pain like now? Do you have any? Okay,
It's
now
just a little bit sore.
just a little bit sore. And we talked about that, didn't we? Because, you know, even 2 months down the road, even though you've been very good about doing your water exercises at least 3 times a week, and sometimes more than that, you still have some residual pain. We talked about that being due to just being out of shape. You know, when you're not walking, joints get stiff, and they take a while to regain. And when you agree with me, the kind of pain you feel down there, if you feel it, it doesn't feel like the RSD pain, does it? Okay, right. Okay, now what I want you to do is I want you to take the other foot, rotate that for me. Yeah, there you go. Very good job. Excellent, excellent. Good job. Now, the next thing we want you to do is once you get up there in front of the door, we know you can walk safely now, but you couldn't even walk before, okay? So we're just going to ask you to take 3 steps forward, please. Add a girl, 3 steps back. Add a girl. 1, 2, 3. Did you have any pain when you did that? Okay.
It's just a little bit sore.
Just a little bit sore. Okay, and we talked about that, right? How to get rid of that. Next thing I want you to do here, Elizabeth, I want you to take 3 steps forward on your toes. Add a girl. Are you going to go become a ballerina now? Is that what you're going to do? Or are you just trying to show off? Huh? Did that increase your pain by walking on your toes?
No, just sore.
Just sore. Okay. Now do your heels, please. That takes more balance. Atta girl. Good job. Now going back on your heels. Again, did that increase your pain?
Just sore.
Just sore. Okay, very good. Now the last thing I want you to do now, this is the big test. Okay, you ready for this? This really proves whether or not you did any good. Now you see that black stretcher over there, okay?
Yeah.
You see it? Okay, here's what I want you to do. I want you to leap from where you are there onto that stretcher. Can you do that? Can you?
Yeah. No, not over, not over.
Yeah, you're gonna fly. No, you can't do it? All right. All right. Sit down. I guess we didn't create a real miracle here, did we? All right. Now listen, let's talk about a few things that happened during the infusion. For one thing, there was 1 point or 2 points or occasions in which you really wanted to almost give up on it, right? Because you felt uncomfortable, right? Now, when you look back on it, describe for us the difference between what would you rather have, the CRS pain or go through another ketamine infusion. Compare the two for us.
Well, I'd rather go through another ketamine infusion. It's a lot better than having CRPS.
Right. Now, I want you to also talk about what it was like for you, the fact that your mother was by your bedside during that whole time. Could you think you could go through a ketamine infusion without your mother being there?
No.
Wouldn't happen, would
There
it?
was no way.
It really kept you grounded and feeling safe, didn't it?
Yeah.
Yeah.
How close did I have to be to you?
She had to like literally be right in my face.
Right in, that's right.
Touch.
Yeah.
Face touch.
Yeah, a lot of
before
touching.
sitting
Yeah,
there.
right. Physical contact. Because remember now, when you get the ketamine, you know how you lose your mind temporarily, right?
Yeah.
And that can be very scary, can it?
Yeah.
Yeah, right.
Kind of feels like
So-
you're down in a black hole.
Down in a black hole. That's right. That's right. So that again, we're using this for educational purposes. It's important for people to understand. That's very critical in terms of making the ketamine work. Is you have to be comfortable. Okay, that's really important. Now, the other thing we want to talk about is that before you had when you had the CRPS, starting in October of last year, you were very sensitive to sounds. You remember that? Has that improved?
A little bit. I still am pretty sensitive to
Yeah,
it, though.
but not as much. Okay,
Yeah.
very good, very good. Now, Mom, I know you've had some questions, so why don't we cover some of the things that you've noticed, some differences that are important to point out.
One of the biggest things that I'd say I've noticed is when I look at her, I see my daughter again. She's happy, she's bubbly, but the swelling in her face, and I'd say the swelling in her entire body has gone down, but you notice it more in her face. She's got her cute little thin face instead of it being puffy, and she sparkles again. Look at those beautiful eyes and how they sparkle.
Yeah, and she likes to kick my, you know what? She's getting sassy, you know,
She
right?
is. She's very sassy. That's my little girl.
Yeah.
She's back.
Don't you stick your tongue at me again. Yeah, that's true. And as a matter of fact, if you look at the photographs that we took, and we'll put those up so people can see it, you'll see there's clearly a decrease in this puffiness in her face after we treat her with ketamine. And she's continued to lose that puffiness in her face, okay? And so a lot of these things that, her kind of I can't think of a better word to describe, kind of a cocky attitude that she had before. That's fair, right? Isn't it? Sort of?
A little bit.
That we can understand when children are afflicted with something like this, it can really make them very irritable, extremely
Yes.
irritable. Do you agree with me?
Yes.
You find the irritability is improved on her?
Oh, yeah.
Less of a short fuse?
The irritability has definitely improved. She's got her attitude back.
Yeah.
What does that word
Like
mean?
I said, she's back.
Yeah, she is. I know I had a difficult time, communicating with her before all this happened. We all did.
Nobody could talk to her. She didn't want to talk. She was so focused on trying to focus on whatever she needed to
Right.
try to beat the pain. Don't ask me a question. Don't ask me how I feel. Don't touch me. Don't come near me. Don't even breathe next to my foot, especially.
Right. That's
There's
true.
even, like,
It would you
fan.
would accidentally like bump the bottom of her foot, like
Yep.
one of her sisters, and she would immediately her pain levels would go up so high to where it would throw her into these like convulsions. She'd get
Right.
scary. She would stop breathing.
Right.
And
Right.
and now you can. I mean, look at this. Let me see your foot. Let me see your foot. Look what I can do to it now. I can just. I mean, this.
Yeah, have fun with it. Now,
Yeah.
what about some other issues that you were concerned about that we want to deal with?
She has asthma. It's seasonal. One of my concerns is something like an asthma attack, or like when the inversion hits in Utah.
Yeah.
This big bubble.
That's
so
right.
It's all this dirty smog down below.
Yeah.
Creating, and her asthma has put her in the hospital for 24 hours.
Sure.
Asthma is a huge concern to me. Is that something that I need to be worried about that could bring her possibly out of remission?
No, well, not so much that, but just for her comfort. In other words, have your bronchodilator there when you live in a city area in Utah.
Yeah.
Yeah, that when that happens, you're just going to have to keep your little bronchodilator available.
Okay.
To deal with those episodes to make yourself comfortable.
And then I've just from doing some research and talking to other kids who have the RSD, something bringing like a flare-up out would be cold, a flu. How true is that? What do I need to watch out for?
Right. Even though she had a bad experience with the tetanus shot, in her arm, I would say the risk-benefit ratio favors her having a flu shot because these people who have CRPS or history of CRPS are just so miserable when they get the flu.
And just let anybody give her the flu shot?
No.
Go
Go someplace where they do a lot of them, where they can use a very fine needle and.
What type of needle?
It's a fine needle, 25 gauge or less.
Okay.
Can do the job. Not very deep. Just get the job done.
Okay.
But do go to a place where they do a lot of them because she doesn't need to go. You don't have to go very deep to get the job done with her. I did tell you though, however, most of us will be over the soreness in her arm maybe 2 or 3 days, but it may last for a week in her case. But she'd rather deal with a week with a sore arm than to deal with the flu, which can really be devastating. So.
To her condition as far as making her flare up. Now, if a flare up were to happen, does that mean she's out of remission or does?
No, not at all. That's why I want you to keep track of her exercise tolerance. Remember we talked about measuring that? Mm-hmm. And also you got the video to measure against, for objectivity. Okay. And see what's going on there because she's not living in a bubble. We don't want her living in a bubble.
We don't.
She knows she's going to be careful not to avoid. She's going to try to avoid those activities where there's a high risk of re-injury.
Right.
But things happen. And you know what they say, SH, right?
Yeah.
Stuff happens. Stuff happens, right? Okay, so. How come you're turning red? Okay, so anyway, any other questions here?
Yeah, her double vision. She's had some double vision.
Yep.
That seems to be improving with goggles in
Sure.
the water.
Right.
And with some drops, like you mentioned,
Right.
over the phone.
Right.
She
right.
still has a little bit of that, but I think it's decreasing with time.
Sure.
The sleeping fatigue. She's so fatigued all the time. I found that I get her these gluten-free protein bars.
Yeah.
That's what pulls her out of bed finally at 12 o'clock, 1 o'clock, 2 o'clock in the afternoon.
Right.
So I've been giving her a lot of things protein-related, but she has extreme fatigue.
Mm-hmm.
She's exhausted all the time. She's, anything that I need to watch for with that. Or
Well,
comment on that.
no. I think you got to give her some time. Listen, she's for almost 6 months. She's been totally incapacitated.
Right.
She needs to build herself back up. Her exercise tolerance needs to be improved upon. All that takes time. Unfortunately, when you're set back with the CRPS, it takes time to restore a lot of these functional things. Okay. So no, I expect that to all improve. The other thing, another question that came up, you asked earlier, what about if she, later in life, what about having babies and that sort of
Yes.
thing? As far as we know, patients, that's not a problem. As a matter of fact, most of the patients that have had ketamine or CRPS, their symptoms usually decrease during pregnancy, okay?
Okay.
So there's something about being pregnant that is nothing to worry about. There are some precautions that should be taken, but it's not something to really worry about.
Okay. And then just the popping of her joints.
Yeah, no, I'm not worried about that, and I don't think you should either, except to suggest you get some earplugs, okay?
Yes.
All right.
It's like nails going down on a chalkboard. It's terrible.
Right.
The other thing is like the cold temperature out in Utah. Again,
Yeah.
we live where it's cold 6 to 8 months out of the year. We talked before about the colder weather bringing somebody out of remission. Could possibly bring somebody out of
I
remission.
don't worry too much about that. She doesn't want to get out into some damp, cold air and get all chilled out. She doesn't want to do that.
So, what type of? So when we're talking about colder weather, I mean, if she's indoors while it's cold, I mean, is she okay? Does she need to?
No, nothing
What do I need to
special.
watch
No,
out for?
nothing special with that. Just the usual creature comfort type stuff. I wouldn't worry too much about that.
Just make sure she doesn't get chilled and cold.
Yeah, cold and dampness can be hard because it kind of makes the muscles really irritable. It's true on everybody, and especially patients that have CRPS. So
So going back and to the possibility of you know, living in Utah, going back out to Utah, and another winter coming up next year, is that something we would need to watch for on bringing somebody out of remission? Because, you know, again, I talked to you before about moms telling me where during the colder months, they would have a flare-up and their kids would come out of remission.
Yeah,
So then
well, generally speaking, this is general, okay? Always exceptions. Patients with CRPS don't do well in cold climates. That's why we got a lot of them that are down here in Florida. We got a lot of them in Phoenix and places like that, okay?
Right.
Because they just generally don't do well. That doesn't mean you have to move, okay? It just means you have to be, you know, a little bit more careful about letting yourself get all chilled out, okay? That's all.
Okay.
Okay?
And water temperatures like beaches and water parks.
Anything between 82 and 86 degrees Fahrenheit is good. Some people want it warmer than that, but that usually gives you an idea of what the water temperature that works best for people like you, okay? Just remember, when you first get in the water, everybody gets chilled for a few minutes, but then you get over it once you get moving around, right? Okay. Okay. All right.
She has a question for you.
What's that?
Will I be able to dance and do gymnastics competitively again?
What did I say? What did I tell you? Don't get involved right now in any high-risk injury things, okay?
Yeah, but
Later, once you build yourself back up again, then you can think about it, right? But not now. That's the most common reason, that by far, the most common reason why people have go out of remission is re-injury, by far. But once you build yourself, give yourself 6 months to build yourself back up again. Then you can start thinking about taking some risk, okay? Got it? All right, okay.
Okay, she was a very active girl. She used to practice dance. She used to dance jazz and hip hop before she has his injury on her right foot.
Okay, okay. So she was very, very active,
Yes,
right?
and she was very happy. She goes all around with friends.
Right. Right. Okay, Valentina, today is January 31, 2014. And your last ketamine infusion was about 6 weeks ago, right, Dad?
Yes.
6 weeks ago.
Yes.
And we just did your pain thresholds, and they've actually improved from where they were when we finished the ketamine infusion on you. And we said the reason for that is probably because she's been doing the heated pool exercises 2 to 3 times a week.
Yes.
Also, she understands that now she's ready to start doing, if she wants to, the elliptical type of exercise, okay? And we also said that she has to be careful about re-injuring herself. As a matter of fact, about a week ago, approximately 5 days ago, you injured your, I think you had a fall, I think you said, and you injured your tailbone, okay? And then you had another injury a couple of days ago, and we said 2 things about that. Number one, that could reactivate your RSD, but it didn't, because we know you're still good. And it also lets you know that you don't have to worry every time, because she does not live in a bubble, right?
Right.
And we said SH, which stands for stuff happens.
Okay.
Why are you laughing? You know too much English, don't you? Okay, so let's go through these exercises for documentation purposes. Are you ready?
Yes.
Okay, so go ahead and put 2 vertical fingers in your mouth, please. Any pain when you do that?
No.
Okay, take that right hand, put it behind your head. No pain?
No.
All right, left hand behind your head. No pain?
No.
Okay, good. Take the right hand out in front of you, open and close as fast as you can. Any pain?
No.
Okay, left hand, same thing. Very good, excellent. Now I want you to go down here. You remember we marked you out here where you had it before, where you had the sensitive skin. Bring your leg out this way a little bit so we can see it better. That's it. Just bring it. That's it. Go see if you can go down there and see if you still have that sensitive skin. Go ahead. Close your eyes. You have that any more of that sensitive skin down there?
No.
It's all gone, huh? Go all the way down to your toes. That a girl. Good job. So that's all gone. That's good. Now, the next thing we want you to do, and then Dad's going to stand by your side, okay? Dad, go up there, and I want you to take 3 steps forward. Okay, and then you're going to take 3 steps back, okay? Are you ready? Okay, you're doing it already. Okay, go back. Don't turn around. Go back, back. Did you have any pain when you did that?
No.
Remember when we first did you 6 weeks ago, you couldn't walk. You couldn't put any weight on that foot at all, could you? Okay. Now the next thing, I want you to hold your dad's hand, but don't use them unless you need them. Do you understand, Valentino? Okay, go ahead. All right, now see if you can take 3 steps forward on your toes. That's 1, 2, 3, and then 3 steps back. Okay? All right. Now, I want to tell you something. You're not ready for becoming a ballerina. You understand? You got to build yourself back up yet. Okay. Did you have any pain when you did that?
No.
Okay. Now do your heels, please. On your heels. Atta girl. 3 steps forward and 3 steps back, please. Good. Again, did you have any pain when you did that?
No.
Okay. Dad, sit down over here. Now we got one more exercise we want you to do, okay? This is the real test. Are you ready for the big test?
Yes.
I want you to take, you see that stretcher over there? That bed, that stretcher, that black thing. You see that? Okay, here, Valentina, here's what I want you to do. I want you to leap from where you are to that stretcher. Can you do that? Leap? No, you got to fly. You got to fly. Okay, have a seat. Have a seat. Okay, there you go. Now the reason you got that cushion is because you fell on your tailbone, right?
Yes.
Yeah. Okay. I think that's gonna get better with just a little bit of time. Okay. All right. Now, Dad, do you have anything to say about anything that you've noticed about? Is she feeling more upbeat now? Is she more happy? Is she contento?
Yes.
Más contento?
Yes, más contento.
And the family, más contento?
Very good.
Okay, good, good, good. Anything else you want? Any questions? Anything else you want to ask me?
No, she have a question in the your
Only
skin.
that I put like creams and it's still being that.
You put cream on there?
Yes, and it's still being like
It's more dry, no?
yes.
Yeah. Is that where the original injury? Is that where you were injured?
Yes.
Yeah. I would not worry about that right now. I think that's going to get better with just the exercise. Do you understand?
Yes, and the other day I noticed that I have like veins.
You have what?
Veins, my veins.
Yeah, veins. Yeah, that'll get better too. That'll all improve with your exercise, right? And again, I want to emphasize that when we finished the ketamine infusion on her, everything was improved. Her movement and her pain thresholds were all better. But she's even better today, even though she's had 2 injuries since then. Everything is better than it was.
Yes.
And I think she deserves a lot of credit for exercising, because that's what makes the difference, right?
All right.
Now, Valentino, do you have any questions at all about anything?
No.
Okay, very good. Excellent.